12 ways to help you stay alive in an emergency. The first thing that springs to mind is asking your family or friends for guidance. But occasionally, even the most well-known and widely accepted advice proves to be incorrect and detrimental. Did you know that putting ice on a bruise is not a good idea, and that moving someone who is unconscious could have serious implications? Here are the 12 ways to help you stay alive in an emergency. 12. To begin with, if you have something in your eye, such as a piece of glass, don't attempt to remove it on your own. Instead, have someone drive you to the hospital. Don't forget to wash your hands before you do anything, even if it's just an eyelash. Blink to make your tears wash the eyelash out while trying to find the eyelash in a mirror. Take a moist piece of cloth and use it to remove the eyelash once the thing is in the corner of your eye. 11. Mints contain undesirable moisture, which is a perfect environment for germs to proliferate more quickly. Applying ointment to a wound makes this point. The best thing you can do is to apply a dry bandage after cleaning the wound with cool water and soap. The wound will heal more faster, as you will observe. 10. Applying vinegar or alcohol to a feverish person. Because both vinegar and alcohol are taken into the blood, they can be used to make strange salad dressings, or as a way to become intoxicated. Seriously, rubbing alcohol may result in drunkenness, while vinegar greatly increases acidity, which is particularly risky for young children. Therefore, disregard these outmoded pieces of advice. Ingest lots of tea, water, and other non-alcoholic beverages. 61-64 degrees Fahrenheit or 16-18 degrees Celsius should be reached as the desired room temperature. The patient will typically recover from the fever in these circumstances on their own, but they should consult a doctor if they do not. 9. The raising of a sleeping individual. Lift the fainting person to their feet and apply cold water to them. Yeah, that's what the majority of people believe. Lifting a fainted person up can just make the spasm worse. So please like this video if you agree. Lift their legs up, unbutton any constricting garments, and prevent them from standing up. Don't allow them to drink the popular energy drinks or coffee as soon as they come to after regaining awareness. Caffeine will simply make you thirsty. 8. Using butter or sour cream to cure burns. Many people think this approach works well. But why do butter and sour cream help you feel better, other than it cures pain? The problem is that we keep them in the refrigerator, so they are cold when we apply them to a burn. However, butter and sour cream might be dangerous since they dry out your skin and obstruct thermal exchange. Because of this, heat is forced deeper into the skin, causing even more harm. You should spend 15 minutes with your hands submerged in cool water. This will lessen the discomfort. Do you know why the burned areas of our body develop blisters? Everything takes place for a purpose. Blisters prevent infection of the wound. Taking away the barrier could cause a fester. 7. Laying a bone by yourself. Do you do trauma surgery professionally? Never attempt to set a displaced joint by yourself. Regardless of how amazing or nasty that appears in the movies, it can cause more injuries and lead to litigation. The wounded leg should be immobilized, and you should get to the hospital as quickly as you can. In order to mobilize not only the location of a potential fracture, but also the two nearby joints, the leg was bandaged in a comfortable position. 6. When your muscles are strained, warming a spring. A heated cloth is ineffective. Heat, on the other hand, will increase blood flow, which can exacerbate the edema. Apply cold to the wound in the early days to reduce inflammation and relieve discomfort. For at least the first 48 hours, try to avoid using the sprained limb as much as possible. 5. Making yourself puke to protect against poison. To induce vomiting is the usual treatment for poisoning. Although it may seem fair, it is actually completely forbidden. First of all, the poison can enter the lungs and harm them. Next, If someone has been poisoned with certain substances, vomiting doubles the risk of throat burning. Finally, once vomiting starts, it may be very difficult to stop, which can result in dehydration and even worse outcomes. The only sensible course of action in this circumstance is to make an urgent call for an ambulance. 4. Rescue someone who is drowning. One thing stands in the way of saving a drowning individual: being unable of swimming. Nothing, however, can stop you from saving that person's life if you are. Keep in mind to sneak up on them from behind so they won't see you. Otherwise, they might slow you down or drag you down while they're panicking. Grab the individual as you get close, either by the chin or under the armpits, and walk toward the shore while maintaining their head at your belly. 3. Removing items from wounds. You can now remove a glass shard from your hand or a finger splinter. However, you must never attempt to remove things from significant wounds. Even medical professionals keep them there till the patient is having surgery. Whilst the object is inside the wound, the thing is, don't do anything, not even touch the object until you are supervised by a specialist, since it prevents the bleeding from beginning. All you can do is apply some alcohol to the wound. However, you need to be prepared for the wound to hurt a lot. No matter how terrifying a knife in the leg might look, it's just a splinter. Don't try to save the day. Simply go to the hospital. 2. Treating a bruise with ice. There is nothing inherently wrong with using ice to cure a bruise, but most people go about it the incorrect way and shouldn't put the ice directly on the skin. Put a piece of fabric between your skin and an ice pack instead of getting a cold burn. However, using a cloth does not eliminate the possibility of burning oneself. For this reason, you should only apply ice for 20 minutes at a time maximum before taking a 90-minute break. We advise against using ice at all if you don't have a cloth available for some reason. A bruise would be preferable to a cold burn. You should also be aware that 48 hours after the accident, utilizing ice is useless. 1. Closing cuts with stitches. Most of the time, using stitches is acceptable. It's the only method of securing a wound. However, placing sutures is a time-consuming and unpleasant process that necessitates removal once the wound has healed. So in some circumstances, a less violent action might be effective. Skin glue is incredibly rapid and almost painless. Use cold water to clean the wound before applying adhesive. Then apply skin glue along the wound's edge, close the wound's margins, and stop the bleeding by pressing on the wound. If the cut, however, appears to be too large, don't take the chance. Instead, go to the hospital for medical attention. If you enjoyed this video, please hit the like button and share your first aid experiences in the comments area. Click on subscribe, then share with your friends so they won't be baffled by what to do when someone needs aid.